Now, we are turning our attention on mental health among young people now. Joining us is Amanda Third, co-director of Young and Resilient Research Centre at Western Sydney University. Professor Third, welcome to the program. Now, first of all, some people regard mental health as being mentally unsound, weak, and so on. What is the biggest misconception about mental health, especially for young children, that you think is important for us to unlearn?
Well, precisely the idea that this is about individual weakness. I think there are there are a number of drivers for mental health, and they are complex. They range from individual predispositions right through to sort of social and cultural attitudes, but also structures impact young people's everyday lives. So whether or not they come from a lower socioeconomic background, whether or not they have access to education, a range of other structural factors also drive mental health. But what, unfortunately, we don't know enough about is exactly how these drivers intersect. And one of the things that we know in the region here is that we are yet to do much more research to understand some of the trends that are underway.
Speaking of research, Professor Third, you did one on mental health challenges faced by young people in East Asia and the Pacific. How do children in this part of the world perceive or experience mental health in their day-to-day settings? And what are the key differences across the various countries and generations that you've uncovered?
Yes, so surprisingly, when we worked in the 4 countries, which were Indonesia, Malaysia, Thailand, and Fiji, we did actually uncover many more similarities than differences among the ways or the experiences that young people are having of mental health. I think what we heard from young people in this study, and it was an in-depth study that talked with young people in sort of workshop-based settings. What they told us is that they have really become more aware of mental health since the rise of the pandemic. They told us that there are a range of things that they think affect their mental health. These include pressure about schoolwork, family, conflict or violence. Sometimes when their relationships go wrong, this has a negative impact on their mental health and well-being. But also, their families not being able to afford basic food and housing, and these kinds of things are really, really strongly impacting the ways that young people experience mental health and well-being. I think one of the concerning things that came out across the region is that young people themselves feel a great responsibility to look after each other and to support one another's mental health, but they also feel very under-equipped to be able to do so. And I think the other thing that they said very loudly to us is that when they have tried to access mental health support, they've found that very challenging for a variety of reasons. But it does seem that across the region we have real challenges in terms of young people being able to access reliable evidence-based services that are affordable and also easy to get to, because of course not all young people are able to move freely around the community.
So having access is an issue. According to one Singapore study, Professor Third, it reveals that roughly 1 in 6 young people in the country said that they experienced externalizing mental health symptoms such as hyperactivity, rule breaking, and aggression. In the case of the recent shooting attack in Thailand, that case involved a 14-year-old gunman, a mental patient who apparently was not taking his medication. What went wrong there? What generally drives them to such a point? Why and when should we be concerned?
Look, it's a really difficult situation when something like this happens, and people always struggle very hard to make sense of them. And I think, I don't want to comment too much on the specifics of that particular case, because that's really down to the mental health professionals who are looking after that young man's care. But I do think what we're seeing is increasing pressures on children and young people across the board, from that very sort of micro level in terms of their interactions with each other, pressures on, as I said, on work and study, right through, though, to some really large kind of existential crises that confront humanity at large. So things like the climate crisis that you mentioned earlier. We have evidence to suggest that this is really seriously impacting young people's capacity to hope for the future and to feel safe and secure. Their horizons of safety and security are drastically shortened. So I think, what we need to do is to really take stock of the ways that our culture is headed and to think very carefully about how we build in the right sorts of protective mechanisms to enable young people to cope with everyday life better than we're enabling them right now. And I think the other thing that incident points to is that despite the best efforts of mental health professionals across the region who are trying very, very hard to make sure that young people get timely and appropriate care when they need it, there are gaps in our systems. Young people often bounce around inside the mental health system before they get a diagnosis, before they receive the proper treatment and care that they might need. So these are things that we really need to begin to pay close attention to.
And Professor Third, focusing on social media, it has quite a bad rep. For example, excessive engagement can lead to a fear of missing out or poor body image. But studies have shown as well that there are opportunities where the platform can be a part of the solution for mental health issues. How can we tap on this platform? Help us understand how tech and social media can provide support for young people.
Yes, look, it's really great. You're right. Technology does have a very bad rap when it comes to mental health. But the evidence is really conflicted. And what we often don't recognise is that technology use comes with a range of very, very clear benefits that have been well documented by the research. Vis-a-vis mental health, I think one of the most important things that young people have told us in the study we've just done is that technology gives them a really important way to relax and, come back down to earth after a busy day and to find, peace of mind. So a lot of the play and the fun that they take part in online is really important to their capacity to be resilient. Also, though, they talked about the very important role that technology plays in connecting them to high quality information and resources about mental health issues, as well as networks of support. And I think this is really not to be underestimated. By no means is all of the information that we find online really high quality. And we need to put effort into making sure young people can find quality resources when they need them. But it does put information at young people's fingertips. And that's really important because the other thing that we've learned across the region is that stigma is still an incredibly entrenched problem. Young people find it very hard to talk about mental health issues with their peers, their families often, and often with trusted adults in the community. So in the light of that stigma, it's really clear that young people would like anonymous, trustworthy modes of seeking support. And if we got the balance right and we really invested in our youth mental health services online, that could well provide us with a really solid way to make sure that young people can receive timely intervention when they need it.
Professor Third, thank you so much for sharing your perspectives with us. That was Amanda Third, Co-Director of Young and Resilient Research Centre at Western Sydney University. Thank you.